So the victim triangle is a trinity of archetypes that are always in relationship with one another. And these are the victim, the villain, and the rescuer. So the victim is the part of us that we were just talking about, feels victimized, feels powerless, feels like boundaries are being crossed, feels under attack, things like that. The rescuer archetype is the one that's there to rescue the victim, right? So the victim and the rescuer always are in a contractual relationship where the victim is looking for a rescuer to save them, and the rescuer is looking to save a victim. And whenever there's a victim and a rescuer, there's always a villain, which the villain is the cause of the pain. The villain is the cause of the crisis, right? So the villain is always the one that's doing the attack or inflicting the wound. The victim is the one experiencing or receiving it. The rescuer is the one responsible to save it or fix it. Now, if we take a look at chronic pain, for example, the way our medical system and actually almost every industry is set up, it's based on this victim triangle. So let's say someone has chronic pain and they're conditioned to believe that the pain is the villain or their body's the villain. They're the victim of it. And this solution is the rescuer or remedy for it, right? So you see in every situation with a pain or an illness, there's the pain or illness, which is the villain. There's the one experiencing it as the victim, and the whatever, the shot, the medicine, the supplement, even the other practitioner, the superfood, whatever it is, there's the rescuer, right? So, every industry, if you look at, oh, you're depressed or you're anxious, oh, anxiety, depression, that's the villain, you're the victim of it, and here, this solution is the rescuer. So you see how it's always set up in that model, which is really what industry is based on. Industry is based on the victim triangle, where there's a problem, there's the one experiencing the problem, and then there's the solution. And you can see how that's playing out inside of us. But what's important to take a look at is how we circulate through each one of those archetypes. For example, we might start out as the rescuer archetype. And we might feel responsible for rescuing all the victims. A lot of times, if coaches or practitioners are not careful, they might actually step into the role of the rescuer, seeing their patients or clients as the victims, and they responsible for fixing or changing their experience rather than empowering the individual. And so what happens is the rescuer in us is always trying to rescue and rescue and rescue. And a lot of times we end up doing so at the expense of ourselves, almost like a martyr. And then eventually we start to feel tired, we start to feel exhausted, or we start to take on the symptoms of the person that we're trying to rescue. And now we feel like the victim, right? So you see how when it comes to pain, when it comes to illness, and when it comes to relationship between client, coach, patient, doctor, whatever it might be, you see all these archetypes playing themselves out within any given situation, which is why self-healing and personal empowerment is the only path to healing, right? There's no one outside of you that can heal you. You're ideally being taught how to activate the healer within.